Hey Heather, have a seat.
Thanks.
How are things going with you since we last saw each other?
They're okay. Um, yeah, they're okay.
You seem a little hesitant. What's kind of going on? What are you feeling right now?
I don't know. I feel like I'm doing all right, but a little bit more anxious since I know that time that we talked about is approaching, that I'll have to talk with my parents about Eli's diagnosis.
I definitely know that's something that you've been really anxious about, coming up with your parents visiting soon, and talking with them about this, surrounding Eli and what's been going on with him. But I think before we kind of explore more of these feelings you have surrounding that issue, I think we should probably set the agenda. So first, let's do that together. What are the types of things that you'd like to discuss today?
Um, well, I think most importantly, I'd like to figure out how I can work on exactly how I'm going to approach this conversation with my parents. And then, if we had any time after that, I think it might be helpful to evaluate some of the resources or outlets that might be helpful for me to better integrate the life that I had in Boston, um, and create more of a routine for myself with my new life in Nebraska.
I think those both sound like great agenda items. Do you have any preference on what we discuss first?
Um, I think since my anxiety about next week's conversation with my parents is so huge, that I'd like to talk about that first and probably focus most of our energy on that. And then after we complete that, I think it would be a good time to move on to brainstorming maybe activities or resources I could get involved with, to make me feel like I have my old life back a little bit, in terms of day-to-day scheduling, um, and to feel like there's something more to my life besides the work that I do surrounding Eli.
Mm-hmm. I think that sounds great. That sounds like a good plan to me. But before we begin, why don't you kind of tell me more about how things have been going since we had our last appointment? I know at the end of our last session, you had spoke with me more about the stress surrounding Eli and feeling a lack of support and escape since you spend a great deal of your time with him while your husband's working. Has that feeling changed at all since we last saw one another?
Uh, you know, I still feel a bit stressed. Obviously, spending the time that I do day in and day out with Eli, um, sometimes it just feels like too much for me.
Did you happen to speak with your husband at all about making sure you take some time for yourself, even if it's in the evening sometime when he gets off work, or sometime for you a few hours on the weekend days?
Yeah, after our last session, I did suggest to him this idea that you're talking about, and he seemed open to it. He's so understanding, and he really listens and can empathize with me about how much time actually goes into caring for Eli. However, he became kind of frustrated with me about how I don't take the initiative for myself and recognize when I just need a time out from everything. I feel like he doesn't fully get it, because he gets to get away from it. He goes to work and does his own thing. He has this professional identity, and then he comes home and he'll spend part of the evening with Eli until Eli goes to bed. So it's actually not that much time. And then we'll have these conversations, and he's just frustrated with me. He's like, why can't you recognize and pull yourself away? And I think it's easier said than done.
Mm-hmm. That seems like a lot that you take on in your day-to-day life. I'm sure just with, having your own time for yourself, trying to find that time for yourself rather, while also, meeting the needs of Eli. But it is important that you do take some time each day for self-care for yourself as an individual. Because in order to initiate care for Eli, you need that time for yourself too in order to provide him with that proper care.
You're completely right. And that's why my husband and I were saying that he's going to watch Eli 2 evenings a week, to make sure that I do get that time to do whatever it is I feel like I need to do for myself.
That sounds really great that he was able to come to that compromise with you. I think that's important not only just for yourself, but also your relationship with your husband, and as well as your relationship, the two of you, with Eli. Are you planning on taking that time to just go out to eat or catch up with some old friends? Or is there an exercise class you want to be enrolled in?
Well, when I lived in Boston, I used to be religious with my spin classes that I would attend. And so I think I'm going to maybe sign up for a class. The local YMCA, I think, offers some. Um, Maybe getting some of my energy out that way would be helpful for all the stress I build up inside of me just day to day dealing with Eli in a new city and all of it.
I think that sounds like a great idea, um, especially if that's something you really enjoyed in your previous time in Boston and it's something that you can bring to your life here in Nebraska. I think that would be a great outlet for you. How about at our next meeting in 2 weeks, you can plan on having a class that you've either started attending or at least signed up for, so you feel like you're taking the steps towards doing something positive and healthy for yourself.
Yeah, I can definitely do that.
Okay, great. Now, how about we get to the topic that's kind of been, at the forefront of your mind? How about we start talking about your parents and about Eli's diagnosis? I know a great deal of the work that we've been doing here in sessions is to prepare you for the moment that's quickly coming up.
Yeah, you're right.
I know a great deal of your anxiety surrounds what you think your parents' reactions might be. We have gone over in previous sessions thoughts of your catastrophizing thinking, that you might think your parents will not possibly accept Eli into the family due to his diagnosis. And I know in some of our previous homework assignments we have done together, as well as that you've done individually outside and reported back to me, was discussing routine conversations you had with your parents regarding Eli and how he's doing on a general day-to-day basis, with the purpose of you guys opening that communication line between you and your parents about Eli before that actual day arrives when you speak to your parents about his diagnosis and when they're in town and see Eli face to face since his official diagnosis of his condition.
Yeah, well, they do arrive this weekend, and I'll have to speak with them. I'm thinking maybe in the car ride from the airport back to our house. I feel like I can tell them once we arrive home because Eli's behaviors have become more pronounced, and they might notice something wasn't right with him.
I believe that if you feel the appropriate time to discuss with discuss with your parents about Eli's condition is prior to arrival at your home, then why not go ahead with that?
I mean, when I talk to them, it's clear that they know something is up. I've mentioned to them in previous conversations that I did have something important to discuss with them regarding Eli. My hunch is that they think it's about his ability to excel in the classroom or in academics in general. And he is when he started preschool earlier this year, I think that they'll probably put their bets on that it has something to do with that. Otherwise, I don't know. I mean, something else along those terms, but it's not going to be that conversation, and I don't know what they'll think.
Well, I think you have done what you can in essence, what makes sense most for you in order to prepare them in some sense of what to maybe possibly expect, what you're going to be discussing with them.
I guess you're right.
I understand why you have concerns, but I think we have been preparing well for this conversation that you're going to have with your parents. And I think that you should feel a little bit more confident. I think you've definitely eased your way and opened up some communication lines that didn't exist prior with your parents that, exist more now from the exercises and different homework assignments we've implemented previous to this session.
Yeah, I guess so. I really have a difficult time getting out of my head that there's this possibility that they might love Eli less or reject him from our family. They have such high standards, and my parents always had these for myself, my siblings, and I know they have them for Eli too, and it just terrifies me.
I hear your concerns, but I think a great way that we can help reduce this anxiety and some of the catastrophic thinking you have surrounding this conversation is if we do something called role playing. I can play you while you play your parents, and then it will kind of reenact the situation of what it might look like, possibly, your conversation with them, to kind of prepare you in essence of what could be worst case and what could possibly best case scenario. How does that sound?
I mean, it's intimidating, but I guess it's worth a shot.
I understand it is, but I think this will be a good exercise if you're willing to go ahead and try and see it out and see where it goes. Okay, so I'm gonna start, and I'm gonna be you. All right,
Okay.
and you will be your parents. So, Mom and Dad, I know we've been talking lately about something I had to tell you guys that was pretty important regarding Eli. And I kind of feel like right now is a good time for us to talk about it.
Okay. I'm sure what you have to tell us is some great news about Eli, that he's the leader in his preschool class or something like that.
Not exactly.
Well, then, what is it? How can it be anything bad? The updates you've been continually giving us have all been positive. Eli's doing great. Eli's wonderful, like all of our kids have been. We expect nothing less from our grandchild. You haven't said anything that would be putting Eli in a category of something bad happening.
Well, there is something that isn't too great. And I haven't shared it with you guys yet, and kind of, in essence, I've been kind of avoiding it because I'm scared of your response, and it's actually been kind of provoking some of my anxiety symptoms that I always experienced with you guys when I was younger.
Well, what is it? Is it Eli can't count to 10 yet? Or he can't do the ABCs like all the other kids do at his age? If he isn't able to, I don't know. He might not be a true Jacobs.
Well, that is sort of where I want to go with this. Eli isn't exactly at the same place me and your other kids were at the same age in our lives.
So he needs a bit more practice. What's the big deal? Heather, have you been doing the routines we did for you in order to ensure that he'd be ahead of the rest of his class come kindergarten?
Well, yes, but...
Then what's the problem here? Maybe you need to practice more with him and set aside more time to have him develop these skills. You and your siblings were all able to do this by this age, and therefore, so should Eli. I don't see any problem, and I don't see why he should be any different.
Well, he's not exactly like the rest of us.
What do you mean by that different? We're strong-boned, well-educated. We're the intelligent Jacobs. He has half our genes.
Well, yes, but the last couple of months, his behaviors have been a bit different than compared to other peers his age. The way he socially engages with others, things along that side, and other things in that area.
So, Heather, get him involved with more play groups. I think if there's anything wrong with him, it must be the result of you not socializing him well enough.
Mom, Dad, that's not it. He has Asperger's.
What? How? That makes no sense. Were you slacking on your prenatal vitamins? Were you eating foods you weren't supposed to during pregnancy? Does this have to do with Jim? Does he have something that runs in his family?
Mom, Dad, no, it's not any of that. Don't accuse my husband of anything. He didn't do anything. Or myself.
Heather, this is just not acceptable. We'll just have to get him all the resources he needs to get in order to get on track like the rest of us Jacobs. He can do it. We have the genes that make us the smart individuals we are.
Okay, Heather, I'm going to stop you here with the role play for a second, and let's try and reflect on what we just did together. I can see where your thinking is going. There's kind of a pattern with how this conversation is going to play out. And I see how your anxiety surrounding the expectations your parents held you up to and the rest of your family as a child and kind of throughout your time growing up, and their apprehensions about what this might mean in reference to Eli and their inability to accept him.
Yeah, something like that. There's just no way that any of this would play out well.
Have you considered some alternative ways of outcomes of the conversation?
Like what?
Well, what's the best that could happen out of this situation? All anxiety aside and your previous notions you have about your parents and how they might respond, do you think there could be any, better outcomes that could come from this situation?
I mean, I don't usually think about best possible outcomes, but when I sit here in session and you ask that, I guess I could possibly imagine that best case scenario, they could come around and decide to accept Eli for who he is. Um, due to the simple fact that he's their grandson, and maybe somewhere within themselves they have the ability to love him unconditionally. Um, I guess following this line of thinking, they could be advocates for him by finding resources that might help him. They might be beneficial to him with getting him on track developmentally, what's appropriate for him, and then being there to applaud the strides that he does make at his developmental level, rather than kind of comparing him to what the norm is just across the board without taking any of his individual traits into account. When I start to think about this, maybe they could even sense the stress and anxiety that I feel surrounding it. And then is it possible that they could become supports to me? Might even start to grasp why I related my childhood stress of, having all of these really perfect performances in all areas of life, and how, that might impact me, and the extent of my being afraid to tell them anything about Eli up to this point.
I know a lot of those thoughts that you just came up with were kind of hard for you to think of, but I think you just did a great job. You just came up with a great deal of different ideas of how this situation could play out in a positive way. The outcome might not be negative. So I want to applaud you for that, because that definitely, I know, isn't something easy for you to do. But I am happy that you were able to do that. I understand that you have doubts with how this conversation may go, but I also think you deny some of the possibilities of certain positives that could arise from this conversation, such as bringing you and your parents closer, and maybe even allowing you guys to resolve some of the issues you had with them growing up. I think this conversation has a possibility of going well. But let's say it does go in the way that you believe it would initially in the role play. How would you handle that? Do you feel you have adequate coping skills to handle that situation?
I think initially I would be really upset, but I guess I would expect nothing else, because that's how I've always assumed my parents were going to react to the situation. I know that my husband is so supportive, and I also have the benefit of being involved in some support groups, and I attend those regularly, and I think those could be a really good outlet to gain insight, on how other people have coped in similar situations. I think receiving emotional support from other parents and from my husband, we're both going through this together, and other parents have gone through similar situations, and so I feel like, developing coping skills from those sorts of life experiences is probably the best way.
I think those are some good ideas. I think we could also explore more coping techniques from what I've already taught you in other sessions, and routines that may kind of help reduce some of the anxiety in various situations that kind of provoke some of your anxiety symptoms that you experience. I strongly believe that you have the tools to handle the situation if the conversation goes worst case scenario. I really believe that the work that we've been doing together in session has adequately prepared you, and I have the faith that, you will be able to handle the situation whichever way it goes, no matter if it goes bad or if it goes well.
I think you're right, and I think even though it was really scary for me to do the role play, and I probably wouldn't have done it, if you didn't bring it up and kind of build it into the session, I think that going over it in a structured way and helping me to practice, it's helpful. It's scary, but it's helpful. And it does kind of empower me, it reminds me of the tools that I have. And then this conversation is reminding me of the supports that I have. And this makes me feel more confident, even though it's not pleasant to talk about. When I think about going into the conversation with my parents, and having to handle it no matter what happens.
I think that sounds good. I'm just curious kind of to see where your anxiety is at this point in the session after going through that role play. I know that initially when you walked in here, you were expressing to me how anxious you were. I know we did not rate it on a scale initially, but I'm curious to kind of see in your head where that comparison of how you felt then to what you feel now, in reference to your anxiety symptoms. So let's say on a 1 to 10 scale, 10 being the worst anxiety symptoms, 1 being the least, how would you feel at this point in the session?
You said 10 is worse?
Mm-hmm.
I would say I'm feeling maybe a 6 or a 7-ish.
Okay. Is that lower than how you perceive you felt earlier in the session?
Yeah, I think it feels like it's lowered a bit. And I think initially when you brought up the idea of the role play, it kind of spiked a little. So that might have been my peak. But this session has allowed me to explore other ways of viewing the situation outside of what you've taught me is my automatic thinking, and that there might be alternatives to how the situation can turn out. And you also made me realize that I do have tools and resources to help cope, if the conversation goes wrong.
Mm-hmm. Good. Well, I'm glad I was able to provide you with more confidence on how to prepare you for this conversation. I think it's safe to move on to our next agenda item now, if you feel that is okay with you. If you want to explore more preparation of this conversation, please just let me know. I'd be more than happy to continue discussing this. I don't want you to feel like I'm cutting you short or anything like that.
Okay, thank you. I appreciate that. But I do think you're right. I feel better about the conversation and prepared for how it could go either way, and how I would handle it either way.
Okay, good. Well, if any other questions come up about it, let me know and we can always refer back to it. So how about we start creating a list of different activities or organization involvements you have had or that you've enjoyed that you used to integrate much into your life prior to your move here?
Okay. Well, I'm sure you remember that I was a nurse at Boston Children's Hospital, which I really enjoyed. And since we moved here, the move itself was a really big deal. But then we got Eli's diagnosis, and that combination of factors, I haven't transitioned to a hospital here. And when I think about my future, of course one day I'd love to get back to it. But I just feel totally consumed right now, and like I need to devote all of my time and attention to Eli's care, and I can't even imagine going back to work right now.
I understand why you feel that way, but maybe there's a way that you can slowly integrate work back into your life, even if it's just, for a part-time or casual work opportunity at the local children's hospital here. Maybe those few hours a week you get away evolving yourself in something you've always enjoyed and had a lot of passion about doing will be beneficial to you, not only for giving yourself self-care to make you feel good, but also maybe it will reflect upon the care that you give Eli and will rejuvenate you and refresh you in ways that you didn't know you could feel that way again after Eli's diagnosis. Do you know of anyone who could maybe watch Eli while you're gone, or if Jim's working on one of those days?
I can't think of like the name of anyone in particular offhand, but I know that in the support group I attend, that other parents have mentioned that there are these specially trained babysitters that have been referred to the group who specialize in working with kids with Asperger's.
I think that would be a great resource for you to explore. That way, you can maybe feel more comfortable leaving Eli with someone else and trying to explore if it's a work opportunity that's what you want to pursue, then you'll have someone to watch Eli in confidence and feel okay about it and do something for yourself too.
Yeah, no, I think that's a good point, and I guess that's, later this week at our session, I can ask the group to give me some recommendations and then look to see if there are any appealing nursing jobs available at the local children's hospital for me.
I think that sounds like a really good plan. How about next session, besides informing me about your conversation that you have with your parents and how that all goes and how you're handling it, but maybe if you have some time, do some research and write down possible job options and positions that might be available that work okay with the time frame that you're able to work with and apply for them.
Yeah, I could definitely do that.
Okay, good. Well, we have just a few minutes left in our session together for the week. How about I summarize what we've covered today and then I'll ask you for your reaction to the session?
Okay.
So, a lot of what we discussed was we explored all the possibilities of how the conversation might go with your parents about Eli, and your anxiety symptoms seemed to be reduced after, we went through the role play together, which I think is great, and I think we worked together, um, and you came up with a lot of great ideas of, best case and how to handle worst case scenario with how the conversation might go. I think that you showed that you have the capability of utilizing a lot of positive coping skills that will help if the situation goes a route that is more negative. And you came up with a couple of good strategies with how you might handle the situation either way, based off of how the conversation goes. We also discussed the importance of self care and getting yourself back into the swing of things, of integrating activities that bring pleasure to you in your life that are outside of Eli's care. You came up with a great idea of gathering resources from your support group you attend, as well as being willing to take the initiative to actively make a search surrounding a possible part time employment opportunity for yourself. Do you think that covers it?
Yeah, I would say so.
Okay, Heather, we have a few minutes left. What would you think is most important for you to remember from this week's session?
Um, well, we covered a lot of important stuff. Um, but I think the fact that you made me aware of the strengths and positive supports that I do have in my life outside of my parents is really important because I think a lot of times I get kind of focused on the negatives and I can't really see past those. So it's really helpful for you to point those out and for me to recognize that I do have supports. I also really think it was important that you pointed out that I do have the capability of coping with the situation um, if it's not totally positive, because that was a fear I had. If the situation isn't positive, which it might not be, that I can cope with it. And so I think this session also helped me to realize the importance of how my own self care can really affect my care for Eli, and that I really should start trying to take more of an initiative in taking care of myself and taking care of Eli.
What do you think about the session today? Is there anything I said that upset you or anything that I got that you thought I perceived possibly wrong?
No, I can see why you used the technique you did with the role playing, to help me better understand where my thoughts are and my challenging thought process, and allowing me to brainstorm the possibility that this conversation with my parents may possibly go better than expected. I guess I'm worried of a possible setback, even though you state that I have the skills to cope with the conversation, if it doesn't go the way I hope. What if I don't have the skills?
I have confidence in you, but I think this is definitely something we can explore more in our next session. And if things don't go more of the ideal route, we can work together with developing various coping strategies and debriefing your emotions and the conversation you have with your parents to kind of help you get to a better feeling state.
Okay, that sounds good.
Is there anything else about the session or anything else you'd like to do differently next session?
No, I don't think so.
All right, well then, I guess I'll see you next week at our next session. That sounds good to you?
Yeah, that sounds great.
All
Thanks
right,
a lot.
no problem. Thanks for your time today.